Greetings, minions and associates. If you are already a minion you would like to tithe, please hit like. If you'd like to become a minion, please hit follow. If you would like to confess, please do so in the comments. And if you would like to evangelize, please share. All right, today I'm just going to be messing around. Let's take a look here. Yeah, I think I'll just play a game. That game took a long time to load. Okay. Howdy, Kiefer. How does POTS get diagnosed? Well, they have what's called a tilt test, and now they didn't actually do a full tilt test with me. Now what they'll do is there's a table, and they have it up like this, and then they have you flat, and then they tilt it up, and they take your blood pressure and your heart rate and so forth, because our heart rate is going to be a lot faster. Okay, and then so they basically take those numbers and they figure out, like for instance, I had an extremely fast heart rate and was out of breath and everything else. And I just did it. I didn't do an actual table test in a tilt table. I did a regular table where I just laid down and set up. And as soon as I set up, the CNA went and grabbed the charge nurse from the cardiac unit because my heart rate went up so fast. So it's not a hard test, although not everybody can do it. You might have to get a referral to a cardiologist, because basically most regular doctors aren't actually familiar with POTS. They just don't know. Now, the other thing about POTS is it's almost synonymous with or identical to COVID, or to what do they call it? The late COVID, long COVID. Why? Thank you for the hearts. Long COVID. In my case, I think I did get long COVID. However, I always had POTS. So what happened was, when I got COVID afterwards, my POTS is just 10 times worse. It's to the point now where it's very difficult for me to actually work or function. I can walk around and do light work, but I like couldn't work for somebody because I can't do that much work. I'm like one of those old folks that stays at home and works on their garden in the mornings a little bit at a time as they can. And that's kind of where I am at this point in time. I'm an old man. But so yeah, that's how it's diagnosed, basically by a cardiologist. And it is the funniest thing. Once I did get diagnosed with POTS, I don't know if you know, we need to increase our salt intake. And this cardiologist looking at me just seemed completely devastated. Like, he's like, well, some of you do have to have salt. Like, it seemed to just kill him to tell a patient to actually eat salt. So I actually asked him how much salt to take, and he said until your blood pressure goes up. When you start having high blood pressure, now you're having too much salt. Other than that, have as much salt as you want. And so I actually have a salt shaker right here that I keep at my desk, and I kind of do that periodically to get my salt intake. I'll do that a couple times a day. I'm adding a little bit more salt to food now, which is gross. Sometimes I'll just get a salt packet, like if I'm on the road or whatever. I'll just get a salt packet and wash it down. Now, POTS is also primarily diagnosed in women. It doesn't tend to be found in men. Only 10% of the patients that are diagnosed with POTS are men. So I'm one of the proud and the few. For me, it didn't take very long. The reason was, I think, is I knew exactly what it was. Yeah, I knew exactly what it was, and in fact, I'm taking beta blockers, by the way. That also helps with the POTS a little bit. I can't remember what it does. But I knew I had POTS, and so I told him, I just told my doctor, yeah, I'm pretty sure I have POTS. This is my symptoms. and I'd like to do a tilt test. And so that's how it went. And so after it took like a month and a half or whatever to get the appointment with the cardiologist. Um, but once I did do that tilt test, then they put me on a heart monitor that I had to wear for a week. And being autistic, that sucked, because they tape it to your chest, essentially. Actually, they send a box to you, and then you tape it to your own chest. But you have to document a bunch of stuff, like whenever you're having heart palpitations or what have you. And that part was actually very difficult for me because of the way they had it set up. I would say that probably most people are misdiagnosed with about POTS. A lot of it is because they're women, because doctors tend to be misogynistic, and still to this day, if a man says this, like it walks in like I did and says, "This is what I think I have. This is my symptoms. I'd like to get a tilt test." Perfectly fine coming from a man. Coming from a woman, all of a sudden, oh well, you're just trying to get attention or whatever else, and it's bullshit. Yeah, they don't take women seriously, and it's bullshit. It really is. And frankly, the fact that I have an external part, I think, is what helped me to get it a lot faster. I'm sorry to say that. I'm just going to be real here. I think that's exactly what happened. It was not cool at all the way it goes down in the medical field. I've seen it. Like my wife's a Marine, and even in the VA, she's just gone through hell. Trying to um, get all the things that she needs. I mean, the VA's not good for anybody, but I don't think it helped her being female, and that sucks. It kills me to even have to talk about this and admit it. No, not to. It's not the fact that I admit it. It's the fact that it's real. What I'm talking about. It bothers me. It, like, deep down inside, like someone not listening to my mother. Are you kidding me? Really? You know. And my mom had like PMS in the '60s, real bad, real bad, and they did like diagnosed her as manic and all kinds of other crap when she was just literally having super. She was one of these ladies that kind of has like really big blown um, hormones and so forth when she was young, and they tried to put her on drugs and do all kinds of stupid stuff because they thought it was all in her head. Thankfully, things have changed a lot from the '60s. Oh, you're in the medical field? Oh, okay. Good. I don't feel like so much of a jerk saying this stuff. I mean, it's cringy. I feel cringy just saying it. I know it's real, but it makes me feel cringy just talking about it. It's like, ugh. Most common thing I see with women and their diagnosis is anxiety when there are so many other factors. Yeah, absolutely. Yeah, yeah. Well, yeah. You're just stressed out. Go home and take these pills. That was the big one that they did, like in the '60s, '70s, or whatever. It's all in your head. Here's your Valium. In fact, my mother got addicted to Valium because they gave it to her in the '60s. She was autistic, and they diagnosed her as schizophrenic. Of course, she wasn't schizophrenic; she was autistic. But of course, they got that wrong. But it is what it is, right? Um, I thankfully nowadays that's not as prolific and not as likely to happen. Um, I think women are being taken a little bit more seriously these days. but there's still a hell of a long way to go. That's all there is to it. They still do that today. Is very frustrating unless they decide to do other testing and find nothing else. Yeah, it's not anxiety. There's actually issues. I'm so glad you're talking about it. No, it's actual physiological chemicals happening in the brain, and yeah, of course that's gonna. If your hormones are off, of course your head's gonna be a little messed up, but or a lot messed up. But it's not all in your head. It's actually medical things going on. It's just like being autistic. It's not all in our head. It's all in our head. It's a neurological thing. It's not. Did I just say that? It's not in our head. It's all in our head. Um, but it's true. It's a neurological thing. It isn't that we're depressed. It isn't that we need some attention. We have a neurological issue, and so I've gone off on a tangent on POTS because it just pisses me. I don't know why I'm so pro women. I guess it's because I grew up. I had two sisters and a mom that basically raised me, and I was taught to respect women. I mean, they were my elders and they were my teachers, my guides, my helpers. They took care of me. Why the hell would you not respect? What's there not to respect there out of all that? I mean, and frankly, well, my family, the women I grew up around when were all very intelligent too, and so I've always looked up to women in my family and so forth. Even as a kid, I just really did. There was none of that misogyny. My dad wasn't like that either. He was very respectful of my mother, and he valued what she had to say, and of course, that's extremely important. Just valuing what you know they have to say. I have. I understand. I have a balance problem. It took a neurologist. Why did it took a neurologist who requested in me Butzler. I spelled. I don't understand that one. But yeah. Hormone imbalances a lot of times have to do with pituitary and thyroid, hypothalamus glands, and so forth. There's so much stuff, and women are so much more screwed up than men. I mean, I took testosterone for a little while, and testosterone really it it was like I went through like some kind of menopause or something. I swear, I don't know what it was, but I started getting hot flashes and all kinds of stuff. I hated it. I can't imagine if being a lady and having your hormones off because I know that women's bodies are way more sensitive to that stuff than men. It has to do with your inner ear. If you've had head trauma and neck trauma and issues, you know what? That's interesting that you mentioned that because my mother was in a car accident. She got thrown out of the car when she was young and got her head hit, and she almost died from it. But it jacked her up quite a bit. But I don't know if they've ever really figured out what was going on. She had a doctor in the '60s that basically said yes, and it was a man, of course. But it was he actually said yes. There's things going on with women that we don't know yet, and so he was very very helpful to her, and he actually qualified what she was saying and what do you call it as being truthful, and she wasn't full of crap. So that was really helpful. Of course, that was the one doctor she had for then the next 30 years she had to deal with. Um, your normal doctors and all that stuff. But at least now things are getting so much better. And the other thing is doctors now are really beginning to understand comorbidities, like a GY a gynecologist or whatever now understands that yes, there are things with the hormone endocrine system and so forth, and so they're having to like kind of morph over to be endocrinologists and study that kind of stuff. So I think it's really good that at least nowadays things are beginning to change, but it definitely has not fully changed. And what's the best part about it is having a bunch of female doctors. And I prefer female doctors. I'm going to just tell you that right now. I totally prefer female doctors. I don't know why. I just feel more comfortable with them because they're not so aggressive. And for me, it seems like they tend to listen more instead of assume they know what you're going to say and then start diagnosing you before you've finished saying what you're going to say. And I realize that they see the same thing every day over and over and over and over and over and over and over. I know, I've been there. Um, but you still have to stop and listen to the patient because each person is individual and not everyone has the same endocrine system or they're not gynecologically the same. You know, people are different. And I think women, I don't know why, but women seem to be way better at at having that, I guess, empathy. So I don't want to sound like I'm anti-men or something. I'm not anti-men, but I don't know. I just saw too much stupid stuff. It just made no damn sense to me. I guess that's what it is being autistic. That sense of justice just messes with me, particularly when I've got a daughter, okay? I want the doctors to listen to her and pay damn attention to her. She's smart. She doesn't make stuff up. You know. So I hope I answered that question of POTS. I kind of went off on a tangent. Yes, that's very true because I always tell they always tell me it's anxiety. I won't keep on with it. Blech. Yes, it's very true because I always tell me it's anxiety. I won't keep going on with this. Yeah, it's not. It's not anxiety. It's real, but it causes anxiety. You know, I'm autistic, and that is not being autistic is not anxiety at all, but it causes anxiety. So yeah, it makes a lot of sense, and I would have even more anxiety if I was a lady, just because of doctors. I've just seen the difference. I've seen how my wife has to fight um, to get what she needs. Right, it's a precursor to anxiety, which makes it worse. Right, right, right. And then the doctor doesn't pay attention to what you're saying. So then now you've got the underlying medical condition, anxiety, and now you're pissed off because you're not being listened to. Yep. Now you're diagnosed with anxiety and you haven't found the root of the cause. Well, oh yeah, yeah. Well, they see, oh, well, you've got anxiety, so they just write everything off because you do, in fact, have anxiety, right? I mean, they're right. You have anxiety, but that doesn't mean you could just write everything else off because, well, they've just got anxiety. And yeah, I've definitely seen that kind of thinking too. Let's see. I'm taking a look around. I'm running 6 different streams. On the other streams, like Kick and Twitch and stuff like that, This kind of conversation isn't real popular. But for some reason on TikTok, I manage to get a few viewers sometimes anyway. What's amazing to me is how in the heck can people stream when they're just sleeping and have like 500 viewers? It just like kills me. I'm like, yeah, I'm trying to get one viewer. What are you talking about? And this person just sleeping, and they got all these viewers. I don't know. Maybe if I was better looking, maybe that would help. Now you get to pop a pill and you still have symptoms. Thank you for your info. Oh, sure. Yeah, I would definitely. Oh, by the way, with the shortness of breath and POTS, my cardiologist looked at me and he's like, "Well, the shortness of breath isn't with diagnosis of POTS." Yes, it is a diagnostic of POTS, and it is a symptom of POTS. I had to look it up because when I got finished with my appointment, I was like, "Doc, you look it up truly because shortness of breath is definitely a symptom of POTS." And I went and looked it up, and I found out why he thought that. Because only half of the reference, like the Merrick Manual, it does not list shortness of breath. But as you look at the other different diagnostic tools, the books and so forth, about half of them do include shortness of breath with POTS syndrome, but only half of them. So it depends on which references the doctors have looked at and what they can remember. So, I mean, if a doctor says no, it's not. POTS is not. You don't get shortness of breath. Try to tell them. Try to if they'll listen. Like probably because I was a man. I don't know. My wife was there when I corrected him, and I was cool about it. I wasn't trying to be a jerk. I was just like, yeah, I study this every day. And the thing is he wasn't going to write me off as being a hypochondriac, because he already had done the diagnostics and proven physically that I had POTS. So he couldn't deny that I had it. I was just extremely informed about it, and I think he knew that. I think he figured it out. And I was, like I said, I wasn't, yeah, you're wrong, Doc. But I did say, you might want to check that out. It's so hard with the doc, and he didn't get pissed, thankfully. A lot of doctors would get really mad if you suggest that they need to learn something or study something. They may not be too happy with you. Now you get to pop a pill and you still have symptoms. Thank you for your info. Oh, well, thank you. I really I appreciate the interaction. And remember, POTS looks like long COVID, and long COVID looks like POTS. And basically, they're the same thing. I mean, somebody could say you have long COVID, and somebody could say that you have POTS. And either way, it's going to be treated the same, essentially. So, I mean, it wow. Weird stuff in my game. I don't even know what it is. Ah, build a building. Okay, I'll build another building. So, you have any other questions about pots or anything like that? Because I am more than willing to share my lack of knowledge. Hello, Tara. How you doing? See what's going on Twitch and Facebook. I'm on Facebook, and the thing is I'm trying to get my sister to get on Facebook because she is in France, and she has my old Facebook, but she doesn't have my new Facebook. And I want her to get my new Facebook so she can watch me from France. Narcolepsy. I have what is called hypnagogic hallucinations. And what that is I start to dream before I go to sleep, which sounds weird, but uh, I I close my eyes, I start to sleep, and I start dreaming immediately, and then after a while I will fall asleep. Now the problem with that is these dreams, if they're wild and crazy, then when I wake up I realize that I had a wild and crazy dream. But the problem is if it's like condu- conducive to reality, like say I dream that I have coffee with some friends of mine, I will never ever know that I did not have coffee with them. Now, if usually there's something weird because it's a dream, and I can pick out, okay, this isn't real or what have you most times, but sometimes I actually have to ask my family or my wife, did this happen? Did that happen? Or what have you. There's also another one that's similar to it when you wake up, you're still asleep. It's kind of like sleepwalking, but you're actually awake, but you're dreaming and hallucinating and all kinds of stuff. That's only happened to me twice. Um, and that's scary as hell. One time I woke up, I was like, man, I need to get some mental health. I can't sleep. I'm having sleep deprivation. And I woke up from this nap and I looked in the phone book and I called this doctor up. I made an appointment for the very next day, and I went back to sleep, and I woke up and I had written everything down, and I went to the place where the doctor's office was supposed to be, and it wasn't there. And so at the time, it was like the 90s. I called up a friend on my cell phone. I said, look this up and tell me. And the doctor's office didn't exist. I had dreamed the entire thing, and I had actually acted on it. And what's scary about that is when I hallucinate and I don't know if it's real or not, I think it may have had a negative effect on relationships. Like maybe I dreamed that they did something or said something nasty to me or whatever. And so in the back of my mind, I might hold this grudge and not even know why. And it not even be real because I was hallucinating the entire time. But most times there's, quote, the elephant in the room, so to speak. Like, um, that something's not right. The biggest problem is when I dream, when I go to sleep, those dreams are filed away as memories. Okay, so if I had a dream that we were hanging out or whatever, and I wake up, that will be filed away because I was awake when I was dreaming as an actual memory. So I will remember having that conversation and us hanging out or whatever, and I might even make references to that conversation to you when it never happened at all. And that's where it gets a little bit scary. But the thing is 99% of the time, like there's only like once in every couple of years or whatever that something happens where I get screwed up and I don't know what was real or what wasn't real or whatever. But because I know that I hallucinate, boy, thank you so much for the heart. I appreciate it because I know that I'm narcoleptic. I It makes it a lot easier because I know to question what I think is real. And there's been times in the past where I've gotten really upset with people. And they didn't do anything wrong. It was all me. It was me just literally imagining stuff. But the thing is like I can still drive. Um, the reason is because I don't nod off when I go to sleep, or if I get tired when I go to sleep, I can just go off on the side of the road or whatever else. But the stereotypical where you just see people just nodding off. That's a very different type of narcolepsy than what I have, and I don't know much about the mainstream narcolepsy. I, Why, thank you so much. I appreciate it. Well, you know what the problem is I was diagnosed 4 years ago with autism um, at age 50, and I've been unemployed due to medical issues, and I have, being that I'm autistic, my hyper focus has become uh, narcolepsy, POTS, my medical conditions and so forth, and spreading knowledge and being. I basically accidentally became an advocate. I didn't mean to. It just kind of happened because the more and more I studied, and the more I got to know people and so forth, the more I got to talking about it, and the more I got to enjoy educating people. And I really did see this extreme need, particularly for those with autism and ADHD. People don't recognize, particularly doctors, don't recognize all the comorbidities we have. Um, I always say no one is just autistic. No one. There's always comorbidities, and like in my case, I've got POTS, Ehlers-Danlos, autism, ADHD, narcolepsy, um, alexithymia, which is basically an inability or a difficulty regulating one's emotions. I'm on a bunch of different medicines, beta blockers, and so forth to help with the flight response. So the thing is in order for me to get better, I had to study and figure everything out on myself. Now, I was a hospital corpsman in the Navy, so I do have a medical background, and as a hospital corpsman in the Navy, I literally had to diagnose people. That was part of my job. Out in the field, when you don't have doctors, hospital corpsmen, medics in the Army, so forth, are trained to diagnose people. You have to. You have to figure out, is this just a little cold, or is this possibly COVID or whatever else? Do we got to send this person in? Do we got to isolate them? What do we got to do? Um, and then so as a hospital corpsman, like nowadays, I could give a COVID test or whatever else and say, okay, pull that sucker out and isolate them in their barracks or whatever I need to do. Now, of course, I was in the military in the '90s, so I didn't have to deal with COVID. But I'm sure you kind of get the idea. So with that medical background, that's how I was able to self-diagnose, um, like my autism and so forth. The way I see autism, like when I looked at the diagnosis, I was like, "Yep, that's just a description of me." It didn't even look like a diagnosis. It just looked more like a description of me personally. And I was like, oh. And of course, I did more and more study, and the more and more study trying to disprove that I was autistic, I was unable I was unable to disprove I had autism, that I was autistic. So I went and got a medical diagnosis. The reason I got a formal diagnosis from an expert, and these people, all they do is diagnose and treat autism. That's all they do, and adults. This was out of Denver. I live in Pueblo, which is about 2.5 hours, well, an hour and a half away, I guess now. Um, that's due to the 75 speed limits on the interstate. But so I went to Denver, and the reason I got an actual diagnosis is, one, I wanted to prevent imposter syndrome, and two, I wanted to combat gaslighting. I was afraid of, well, you don't look autistic, you don't act autistic. Of course, as the years have gone by, I have never had anyone that looked at me and said, "You're not autistic." Even like I've run into kids that I went to high school with, and I'm like, "Yeah, I'm autistic," and they're like, "Oh." Like, that explains it. So Yeah, it's more like that explains it than anything else. So I haven't had anyone act particularly surprised, but no one ever told me I was autistic. It has a lot to do with the DSM-5, which now they are changing to the DSM-6. It's a checkbox. When is the DSM-6 going to come out? Because I know they got the DSM-5 TR that they came out with last year. In fact, that's one of my weed out questions. One time I went to a counselor and I was like, yeah, what's that diagnostic book thingy called? And I was expecting them to say the DSM 5 instead of the DSM 5 TR, which was the most up to date, because I wanted to see how up to date they were. And they couldn't tell me what the name of the diagnostic manual was, so that was the last visit I had with them. Another time, I looked at another counselor. I says, what can you tell me, or what are the three main diagnostic criteria of autism? And they're like, well, let's just talk about your depression today. And I says, no, what is the three main diagnostic criteria of autism? And he went on to, well, let's just talk about your depression because that's really important. I looked at him and says, you don't know. You don't know what the diagnostic criteria of autism is. Please find out. And I fired that one too. The DSM-5 is terrible. That's why they're changing it to the DSM-6. DSM-4 is much more accurate. Well, yeah. Well, the DSM-4 had autism broken up into like 4 or 5 different categories, which actually technically may have been better. Now, I've read that the reason they consolidated everything is because it was confusing the hell out of the doctors. And autism looks so much like autism, trying to find the nuances in the different types, or trying to specify certain things in autism. I think what ended up happening is they basically how should I put it? The doctors were misdiagnosing people within autism itself. So what they decided to do was consolidate everything into the spectrum. Yeah, DSM-5 for clarity has clump diagnosis, and you kind of find one that fits. It's very inappropriate. Yeah, absolutely, absolutely. Um, yeah, all the diagnoses got clumped together, like Asperger's and so forth. And frankly, I think it is appropriate to have those divisions. However, if doctors can't figure out what they're doing, and then fine. Well, I say we just stick with the one diagnosis of the autism spectrum. The other thing that I do like, and I'm not saying it's better, but what I do like about the generalized autism spectrum is it's not as demeaning to those with the higher support needs. We're all just autistic, instead of like this person is more autistic than this one, because we know that's not true. We're all autistic no matter what. We just have comorbidities and different challenges within that autism. So I really, really hate like when I have like high support needs friends or whatever, when they are looked down upon as being less autistic or less human being than other people that are more capable of supporting themselves. That's why it's very important to tease that out. It is check the box and the DSM. What do you mean by check the box? I don't exactly understand what you mean by that. Are you talking about how you can just go down the criteria and check each box and then basically have your diagnosis? It, or if you can't check the box, that's not the diagnosis, that kind of thing. What the DSM does is that you have a list and you check okay, or I'll use the ADHD. They have you check the boxes. Okay. Okay. So, okay, that's interesting. I didn't know that. I never have really messed with it in that respect. You keep checking the box, so therefore you get the diagnosis for ADHD. However, you got to tease out. Yeah. When I got my I knew I was autistic. Like, there is no doubt in my mind I was autistic, but I had no idea about the ADHD. I had no clue. And that was one of the first times I got a 2-for-1 special, and I wasn't wanting that 2-for-1 special. The doctor looks at me, she says, well, I don't think you're going to be too surprised. You're definitely autistic. But then she decided that she decided that I was ADHD too, darn it. And that's what surprised me. I did not know that I was ADHD. So I got a 2-for-1 special on that one. They want you to put they want to put you on medication for when you're in school because you have to have, they coined the, okay, they want to put you on medication for when you're in school because you have to have what they coined because of behaviors. But we were not looking at home life. We were not looking at cultural issues. Oh, yeah. Absolutely. Cultural issues are a big one. I actually do. When I do, there's more times than that. They do not put them on medication. Yeah, I've even had, like, speech therapists here in Pueblo. There's, in Pueblo, Colorado, there's a lot of there's a lot of Hispanic influence here in Pueblo, Colorado, and a lot of words like Safeways. We go to Safeways, okay? Now, Safeways, you don't go to Safeway, you go to Safeways, okay? That's a dialect. But a lot of times with speech therapists, there's one speech therapist, what they were trying to do in school was count these kids as having speech problem because they were saying Safeways, when that's a local dialect. And the reason they were doing that was so that they could build a school and keep the kids in speech therapy so they could make money, which is pathetic. I actually do, and when I do that more times than that, they do not put them on medication. You're saying that they just want to put kids on, just basically just medicate kids just to get rid of them? My mother used to medicate me. Do I ever have deja vu? My dreams are very long. I have deja vu some for 3 minutes. No, I do not have deja vu. I hallucinate when I try to go to sleep. When I was a kid, I had deja vu a few times, but definitely not a thing for me. Deja vu is a very, very trippy thing. It's not creepy, but it is a very strange thing. What that means is I do a deep dive. I don't just check the box. Yeah, I understand that, Lee. That happens to me if I try to fight sleep. What is that? Deja vu? Trying to fight when you're trying to fight sleep, or do you hallucinate when you try to fight sleep? I hallucinate. I start to dream before I go to sleep, and that's my type of narcolepsy. It's called hypnagogic hallucination. It's also related when, what do they call that? Sleep paralysis? Have you ever had sleep paralysis, Karma? I have had sleep paralysis, and that's terrifying. One day I laid down to take a nap, and I couldn't get up. I literally could not wake up. Oh, you hallucinate? You have both. Oh, really? Have you seen a sleep doctor? I mean, have you gotten this looked into? Because I mean, you this is really important to get this down. Um, and also, do you generally recognize? Thank you for the heart so much. I really appreciate that. Um, do you hallucinate like I do is before you go to sleep, or do you hallucinate when you wake up? Yes, please see a doctor about that. Yeah, Lee's saying yeah. Please see a doctor about that because that could be very scary. I'm in the 80s, but when I was five, oh my goodness, Karma, still, I mean, heck, you've got 80 years of dealing with it, so you probably, okay, it's only when you try to fight sleep. Yeah, I was like, you got 80 years of dealing with it, so you probably got it down pat whether you see a doctor or not. I was 50 and I kind of had it figured out, but it was nice to know that it was real, I guess, and that it that there was something I could do. Now I'm taking gabapentin, and it really helps. Now I start to sleep a lot quicker. When I can almost sleep on demand. Oh, it was in the 80s. You're 42. Okay, I misread that. Okay, at 42, I would definitely see a sleep doctor. I didn't really get serious about my sleep doctors until well in the last 2 years, and now that I'm on the gabapentin, it's really helping me. But I slowly went up on the dose. Now I'm on 600 milligrams a day. I take 300 in the morning, 300 in the evening, and that's very very helpful. Also, I don't have as many hallucinations because I do go to sleep much quicker, which is really cool. So that means I have a little bit better quality sleep, but my sleep is still all over the place. I sleep on and off throughout the day. Yeah, that's what I call it. Sleep on demand. Is that's exactly what I call it. Sleep on demand. I hallucinate when I try not to sleep. I kind of have a set schedule that helps. Yeah, I'm basically, I guess you want to call it retired, um, medically retired. Oh my goodness, I take so many dang medications. Whew, I take one that's a toxetine, a toxmoxetine is one. I take different, and I don't erisnerperol. Okay, a ripperzole. I don't even know what that one is. I take gabapentin, and that's a beta blocker. I think that aristopol is a beta blocker. Buprofen is basically Wellbutrin, which is a mood elevator, and that's just for being depressed because basically all autistic people. Okay, I can't say all autistic people, but if you're autistic, you're more than likely have fought. No, I have not taken that medication. Omnitrol. It sounds really close to some of the ones that I take, though. I wonder if it's a similar medicine or a derivative of the same medicines, like the ripperazole. I don't even know how to say these things, and I should by now. I don't think anybody does. Maybe the creators don't. And let's see. I'm also taking metformin right now, and metformin's because I am pre-diabetic. I am almost practically diabetic. I'm not diabetic. I'm practically diabetic. So I live my life as if I am diabetic because I if I had gotten one more point on my last test, then the doctor is like, yeah, then we're talking insulin and we're talking the whole shebang. So she's like, Really, we're going to put you on this medicine. It helps to control this, and watch your diet. Basically pretend you're diabetic. So that's what I'm doing. I guess I could have added diabetes up there too, but it's not really one of the psychological issues that I like to talk about concerning, with um, it's not generally comorbid with autism. Diabetes isn't. Let me see. I'm going to see what else I'm taking. Oh, this is a good one. Propranolol. That's another one I take. Yeah, I take a lot of medicines. I don't know what else. Oh, got guyfunicine, which is speed, of kind of like speed, and that's for the ADHD. Some of the medicines are for ADHD. I take like 2 of those. Let's see. Karma says, I have also had 5 concussions, so I have a TBI. Oh my goodness gracious. Woo! Oh, I don't want to mess with the TBI. That is not cool at all. I had a brother-in-law that had a TBI, and one day he had his boombox, and he's sitting there listening to it, and he looks at his sister and he says, "Where is my boombox?" And she's like, "You're holding it." And he says, "I know that, but where is my boombox?" And she's like, "It's in your hands." He said, "I know." And he started almost get violent with her. She started getting really scared. And I can't remember if she ended up taking it out of his hands and putting it back in his hands or what. But she finally did something that triggered his brain so that he could figure out what he was doing. But that was really scary. TBIs are just, they aren't nothing to play around with, I hope you haven't had that kind of thing, to anger issues or anything. There's a lot of those things that can be related. Oh, yeah. Right. I know it can cause severe anger issues and confusion. He also had a deal where he would watch TV and he would think it happened to him. And so he would be telling you about a story or something, and you would have to try to figure out if it was something that actually happened to him or if it was something that he saw on TV. So yeah, TBIs are not. And there's with TBIs too. The other problem is they can go anywhere. They can do about anything. I mean, you just don't know. It's where and how it affects the brain. But I hope you are recovering from that. I really do hope that. Okay, most of them when you were 9. So has your brain recovered from that? Now, they used to say, this is interesting, they used to say that we did not regenerate brain tissue, but they have found now that we do regenerate brain tissue and that our brain not only can scar, but it can heal too. For TBI, any kind of head concussions, especially TBI would be biofeedback, is very successful. It's kind of funny is because I didn't ever get a TBI, but I had childhood epilepsy, and I would get partial seizures of my leg. And I'm going to try to get close in here. I don't know if you're going to be able to see this, but right here is, if you look, there's I have scars here. And what it is, I would fall flat on my face. I'm lucky I didn't get all kinds of concussions. I don't know how I didn't. I even saw my skull one time. I hit my head so hard. and then my mother, after I'm getting healed up, I was like, "I want to go ride my bike, Mom." And she knew I was clumsy as hell. And she just figured I was a klutz. So she started wrapping my head in ace bandages. I had ace bandages wrapped around my head this thick. I was the OG original helmet kid, okay? I was an OG helmet kid with these bandages wrapped around my head whenever I was out playing. Everybody looking at me, wondering if my parents beat me or something. uh, oh, I would love to hear your story. Actually, if I would, if you want to join me at some point in time, um, I would, I would certainly enjoy that if you wanted to join me. Every once in a while, I do have people who come on, and I actually want to have more and more people come on. And you requested to join. Actually, um, I'm well. I'll tell you what. I can't really have you join on TikTok because then nobody else will be able to hear you. And I'm on Kick, Facebook, let's see, Instagram. What else? Twitch is up there, and I'm also live on YouTube. So what I usually do is I am the autistic page on Discord, and so I would request to join, but not today. Your knowledge, and I think my knowledge would be very helpful. Oh, absolutely, Lee. You definitely do seem very knowledgeable, and that's really awesome. But if you go to Discord, I am the autistic page. I am David Page, and usually what I'll do is I'll send a link. I'll just hang out with people, bullshit, whatever, and I'll just send a link on Discord to Video Ninja or StreamYard, and then I can go through OBS and I can broadcast on everything all at once. I'm going to screenshot your page because, hey, you know what? I know exactly what that is. I know exactly how it is about not remembering stuff. That's for sure. In fact, ta-da! Here's my whiteboard. Right within arm's reach. I use this to take notes and keep dates and stuff because a lot of times when I have friends or whatever trying to come on, I forget what I'm doing. So, any more questions on autism, ADHD, and actually, that's the one thing with ADHD, autism, and ADHD. We do tend to have kind of memories. You know what? I don't know how to get the link. How do I get the link? Here, we're gonna cheat here. Here's my Facebook page. Let's see. Okay, here we go. This is my Facebook page, if you can see it. It's I've only got 15 friends on it right now because I just went to a different Facebook page. And so I started a new one to basically as the autistic page. My other one, I was doing atheist content and so forth, and I had so many friends on there that I just decided to start clean. But you should be able to put David Page or the autistic page, and I should pop up there. And then my emblem here that you see in the middle, I've got that on everything, so I'm kind of easy to find that way. But I don't know how to get the length. Setting help support. I don't know how to get the link. I know you're right. I know there's a way to do it. Settings, language. Let's see. I would like to know about the Ehlers-Danlos. Ehlers-Danlos. Ehlers-Danlos, that's the the two doctors who named it, and it is a collagen disorder. And what it causes is hypermobility or extreme hypermobility. I can just do all kinds of stupid things like this or whatever. And it's all of our joints are loose. And so what happens is your collagen, when it puts the cells together, it's like this. It glues itself together like this. But with people with Ehlers-Danlos, our collagen doesn't fit together like puzzle pieces like that. It's more star-shaped, and it tries to stick together like this. So it does stick together, but it doesn't stick together very well. And instead of having that nice bond. And so we get stretchy. Oh, you've got that too, Karma. How am I doing at describing it? So what ends up happening is your joints. I don't know. Actually, my arm's pretty straight. You'll see it a lot of females where their arms will end up going down here or whatever. But it's very, very common comorbidity with autism. If someone has autism, it's my recommendation to see if they have Ehlers-Danlos, POTS, ADHD, audio processing disorder, dyspraxia, alexithymia. There are just so many comorbidities. And it's my recommendation to all doctors to, if someone says that they're autistic, remember, no one is ever just autistic. And I think it should be almost mandatory if someone's diagnosed with autism to just go down a list and check to rule out narcolepsy, rule out epilepsy, rule out POTS, rule out Ehlers-Danlos. I have that, and yes, I am female. Thank you for sharing. Well, Lee, I don't know why I had a feeling you're a female. I can't really see your emoji. What was I going to say? Yes, 90% of those with POTS have Ehlers-Danlos, with POTS are female, and actually I think there's more females with Ehlers-Danlos than there are men. I'm not really sure on that, but you definitely, it seems to be more prolific or harsher on females from what I've seen. I have never heard of a man saying I'm completely debilitated by Ehlers-Danlos, but I have heard a lot of women that are literally disabled to where they have a difficult time functioning because of Ehlers-Danlos. But I could be wrong, and that's just my personal experience on that. But I do know for the POTS, 90% are females. I think autism affects women differently than it does men. And I'm talking cis male and cis female, not gender here. I'm talking actual sex. Oh, I'm going to say is most of my joints pop out of place, and all they want to do is surgery, and I won't. Yeah, good idea, Lee. I would not do surgery at all. My shoulder, well, I can sit here and do all kinds of stupid stuff with it. My shoulders pop out, and when I sleep, I have to have two pillows and stacked up kind of high so that my head is really pulled up so I don't put too much pressure on my shoulders, because my shoulders dislocate when I sleep. And not completely, they just pop, stretch out of place. And after a while, the pain gets so bad that it will wake me up. But I'm a man, and my Ehlers-Danlos is not near as severe as most females that I know. Yeah, well, I have a pillow that has one of those cutouts in it, but it's a thick pillow. And I've also got another pillow that's a lot like this pillow that it's a funky shape. But I put this literally on top of my other pillow. Um, so that way, and I also pull it down. So I have one pillow here and then one pillow here, so my shoulder's underneath and my head's on top, if that makes any sense whatsoever. But that helps my shoulders to keep from dislocating. Um, but Ehlers-Danlos is a joint disorder, and my son, he also had a bone disorder that went with the Ehlers-Danlos, and that wasn't cool at all. That was part of the reason why he committed suicide, because of the pain and so forth, because he was not functional very well. That makes sense. Thank you. I appreciate you very much because I wake up with bad headaches and etc. Now I thank goodness. That's another thing that's more typical with females with autism. I don't know why, but headaches. And it's not talked about a lot, and it's not super prolific, and it's not something that is epidemic with autism by any means. It's a smaller group of people, but there is a small group of people, particularly females, that do tend to have migraines. And I don't know why. I don't understand it. And I never have heard that out of men. But then again, I'm finding now, it seems like through TikTok and so forth, there's more and more women are starting to get diagnosed. And this is awesome. But I think as time goes on, we might end up at some point in time having more women diagnosed with autism, Ehlers-Danlos, blah, 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 because women pay more attention than men. Right now, the medical field is very misogynistic and still tends to only want to diagnose boys. But as that's changing, I think we might have more and more women. And we actually, at some point in time in the next 20 years or so, we might have more women diagnosed than men. I'm guessing. I'm thankful for your oh well, thank you so much. Um, I'm a good advocator. I do public speaking, and I like this. Oh, really? That's awesome. I would love to do public speaking and stuff and talk about these things. Well, I guess I am kind of doing public, but I'd like to do it in person and uh, meet people out in real life. That would be really, really cool to do that kind of thing. I do know some autistic people. I have some autistic friends, but it's really, really hard to get together because some of them are real high support needs and so forth. Um, and some of them are like level two, Insurance companies do not like that. However, I'm gone up against so many of them. I'm gonna say, yeah. Luckily, I am a veteran, and I am found you on Discord. Awesome, awesome, cool, cool. I will get to that friend request, and actually, I'll probably be on Discord this evening. If you want to hang out or whatever, say hello. By all means. And then I do sometime voice. I am trying to get to where I do voice calls every evening. Um, I've got some friends that I talk to, and we just bullshit. Just bullshit. Like last night, we did a live, and after that, we shot the breeze for a little bit after the live. I'm connected to the Veteran Administration. They don't harsh me. You know what? Okay, I got a story about the VA. I've got a lot of stories about the VA. When I first got diagnosed with autism, I told the VA that I wanted a doctor that was familiar with autism, and I wanted a counselor that was familiar with autism. And they would not provide me with an adequate psychiatrist or counselor. And I went through the bells, the hoops and ladders and everything else. I did have one doctor very briefly that was excellent. She was a psychiatrist and she knew she actually was up on autism, which surprised me. And then they took her away. For 3 years, I fought and fought and fought trying to get a doctor through the VA. What ended up happening was my son committed suicide. He was autistic. He killed himself. I flipped out. I went to the Veterans Administration and I told them, look, for 3 years now, I have been trying. Now, he committed suicide last October. So in September, I went to the Veterans Administration and I told them this, and this is very messed up. I told them this. I says, look, for 3 years, I've been trying to get the mental health care that I need. My son did not get the mental health care that he needed, and he's dead because of it. If I do not get the proper mental health care that I need by New Year's Eve, I've already put this on TikTok, I'm going to take my life out of pure protest, and I was willing to do it. And within that 3 months, right before New Year's Eve, they got me back with my doctor that I had. And not only this is what was cool. She is now the only doctor in the Veterans Administrations that sees autistic veterans. She has 1 day a week that's set aside exclusively to see, and this is how I set it up, and I framed it. I said, look, post-COVID, any doctor anywhere in the world can see an autistic patient via video, right? Just have a video meeting. And the same thing with the counselor. And I told them, I says, look, you have tons and tons of counselors and psychiatrists all over the world that do have experience with autistic people that work for the Veterans or that worked other places before they worked for the Veterans Administration. I said, send out an email to all of your mental health staff and ask, do you have any experience with autistic people? If so, please respond. Bam! Now you have a list of counselors and psychiatrists that can see autistic people. And a psychiatrist in Guam can see a person in Kentucky via video post-COVID. And so I encourage them to generate that list so that autistic patients could be seen. And Dr. Majors is her name. She's out of Aurora. She is an in-house doctor at the hospital. So if you go to mental health and call up Aurora. You have to call Aurora, the hospital in Aurora. Ask for Dr. Majors in mental health and tell them that you're autistic, and she will see you. It doesn't matter. It doesn't matter with this. It doesn't matter with jurisdiction issues, as far as I know. She didn't tell me where she was seeing those patients because they're running a special program because no one else can see autistic patients. There's no one specialized. And she told me that she was working it out as a pilot program. And so they might make the exemption. All I know is if I was in California or whatever and I wanted a professional, I would definitely call Aurora, ask for mental health, ask for Dr. Majors is her name. It's Majors, Majors. And she is like I said, she is the only doctor in all of the Veterans Administration that is exclusively seeing autistic. Well, she doesn't exclusively see it, but she sees autistic veterans, and she is an expert, and she knows what the hell she's doing. So, and she said that they're trying to work that out as a pilot program, and so I would call her, and I think she could make it happen. Yeah, I think in this case they are going to give an exemption because there's no other psychiatrists at this point in time because they haven't done what I said and sent out the emails. And the funny thing is, all I got for 3 years from the Veterans Administration is, well, there's a big bureaucracy and it's going to be really hard to do that. I was like, it takes 3 seconds to write the email. If you have any experience with autism, please respond. Send. Right? That's it. One person. to all of mental health. That's all you have to do. Send. But they said that it's too much of a bureaucracy, and it might take a long time to be able to do that. Yeah. Send an email. Okay, there are jurisdiction issues when it comes to seeing clients, so I'm allowed to see them in California. There are jurisdictions, however, they can give you an exemption, but it's only a small window. Yes, right now. Hello, Fiddlehead. How you doing? She just left. Fiddlehead, come on. Fiddlehead jumped in and jumped right out. There you are. Hi. It's good to see you. I've been trying to get a hold of you and talk to you, but on the Discord. Yeah, I know you have. I've been trying. Okay, I say I've been trying to get a hold of you. I haven't been doing it that hard, but I've been wanting to get a hold of you on Discord and set up a time to BS on a live. No, it's a lot of it's been intent, and then I get on Discord and I see like some of the rooms, and I get apprehensive. Probably accidentally left. I do that all the time. Hello, Karma. I've been so busy. I know you have. I am so excited about what you're doing, Fiddlehead. You have been. I know you may be upset about your growth or whatever else, but you are growing and you are doing great, and you're putting out great content, and you get me really excited. You really do. Fiddlehead is a great advocate. She really is. She's just awesome, and so I love you, Fiddlehead. Don't forget that, okay? Even if I don't talk to you that much, I love you. So, yeah, we've been talking about narcolepsy, POTS, Ehlers-Danlos. Haven't really talked about autism that much. Fiddlehead says, I'm battling anti-homeless and anti-masking laws in my hometown. Anti-masking laws? What the? I've got what? Anti-masking law? What? Also, a tornado hit our hometown. Oh my goodness gracious! Well, I hope everybody's okay, and I hope your family's okay. That's a bummer. Thankfully, I don't really live in tornado country. I live in Colorado, and I mean they have been here, but it's not real common. I've been in 2 tornadoes here in Colorado. One right here in Pueblo. Everyone's safe. Things just got destroyed. Okay, well, I'm glad everybody's safe. That's good. I'm glad to hear that. Excuse my autocorrect. Autocorrect is the true Satan. That's all I gotta say. It is the real Satan. Autocorrect hates me. The mask ban in the Long Island. So if you want to wear a mask, like I'll tell you this right now, COVID is still out there. I don't give a crap what anybody says. COVID is out there, and if you look, you can see it is out there. And I would wear a mask all the time when I left the house. If I was alone, but my wife is a massage therapist, and she has a lot of contact with the public. So basically, I'm like, no matter what, she's going to bring it home to me. And they have brought COVID home to me 4 times now. That's probably why my POTS is so bad now. And I finally did get diagnosed with POTS, but I think it's POTS / exacerbated by long COVID. In other words, I had POTS, and then I got long COVID, and it just made it that much worse. You've had it 6 times, Karma? Oh my goodness gracious. See, I've had it 4 times, and I didn't know it. I just, a little tired, not much, just whatever. But my family had it, so I got tested. And yeah, like I had it. I just didn't know it. But thankfully, it didn't really hurt our family that bad. Um, and we've gotten all of our shots. In fact, I need to get another booster here. Um, get your vaccines. Vaccines do not cause autism. Vaccines save lives. I'm going to say that again. I have a dead friend, a dead anti-vaxxer friend. Dead. Get your vaccines. Sorry. But yeah, I do have he was anti-vaxxer and he's dead. That's all I got to say. Yeah, that got really quiet on that one. Uh, he was a vet, a veterinarian. Like he had a medical background. He should have known. Really sad. People with cancer and other illnesses wear masks. I think everybody should be wearing a mask still. Karma says, I got it from my family at the end of 2020, then 2021, 2022, 2023, twice in 2021, twice in 22, twice in 23. Oh, my goodness gracious. Oh, my goodness. Karma, you're in the medical field. I also work with little kids for the last 2 years. I worked in a pediatric clinic for about a year. I constantly had the runs. I was constantly sick. I stopped working at the pediatric clinic, and I don't get sick anymore. They bombarded me with everything. Those kids, they got me so sick that now I'm immune to everything. They want to be able to identify people now. What do you mean by identify people now? That's getting scary. Fiddlehead. Scary's talking about the masking here, or the mask. I think everybody should still be wearing masks. Do you know? There were like 2 million cases of the flu in like 2019 or 2018, and then when COVID hit, it went down to like 5,000 cases across the country from 2 million because everybody was masking. I think everybody should still mask. Now, I know that's not convenient or whatever else, but hey, particularly in hospitals right now, or medical clinics or anything else, yeah. And that's not happening, and I think that's crazy. We know better. And think of the epidemics that we could stop if we did just that. Karma says, you were talking about your head injury earlier. I've also seen and touched my skull. Bike crash, 5 years old. Yes. And it was a bike crash for me when I saw my skull. Most times it was from my leg becoming paralyzed as I was walking. This is the thing. I had 97 stitches in this little tiny spot here on my forehead. And the doctor kept on going, I can't sew this. The stitches keep ripping through his skin, and that was from my Ehlers-Danlos. I wasn't diagnosed with the Ehlers-Danlos until many, many years later. But this was a plastic surgeon that operated on me, commented about how difficult it was to stitch me, and as it turned out, I actually had Ehlers-Danlos. But yeah, it was a bike crash in that particular instance. But like I said, the thing is if anyone is diagnosed with autism, I think it should just be automatic. They should have a list of at least, I know there's up to like 30 comorbidities, but you could have a solid list with about 15 of very common stuff like narcolepsy, epilepsy, POTS, Ehlers-Danlos, ADHD, those kinds of things. Okay, we'll say a hot list of 10. Easy. crap. I'm almost out of coffee. And my narcolepsy is actually is called hypnagogic hallucinations, is what that's called. And that's where I dream before I go to sleep, which basically makes you sleep deprived all the time. There's a lot of times my wife will wake me up because she'll recognize I'll start talking or whatever else, and or I start flailing around. David Page, I'm very sorry to hear this happen. Oh, nah. You know what? Life is life. I'm just very, very happy at this point in time to have been diagnosed with autism. I center of my head the size of a dental floss pick. The where I could see the bone was about the size of an eraser, but the whole thing was probably the size of a $50 that was just and then it's a head injury, so it bleeds, you know. And it was rush hour. It was Houston, Texas, and it was rush hour when I hit my head. It was about like 5 o'clock. So my wife or my mom lays me in bed. She puts this bandage on my head, and she's was so cool. She kept me calm. She saved my life probably by just keeping me calm. But she's like, you know what? There's really bad traffic right now because it's rush hour. And it was. And she's like, I'm going to take you, but let's just relax here for a little bit. And we'll go in an hour. And that's what we did. So it was really cool. My mom was so amazing. Okay, that was the same as yours, how your injury was? Yeah. But it was really weird because my mom told me, she's like, I can see your skull. And she let me see it in the mirror, and I was like so fascinated by it that I could see my skull. Karma says, I remember leaving footprints in my friend's front room doorway. Oh my goodness, bloody footprints! Oh no! But I touched my skull. It was gray. Dad didn't look. I was already touching it. Oh my goodness. Oh, that's funny. Yeah. I didn't get to see it that much. My mom gave me like a makeup mirror and I looked at it real briefly, but she was like, okay, you know, she really prepared me for it. She was really cool about it. And after the thing is I had dyspraxia. I was autistic. I had dyspraxia. I was the kid in school that was the last one. We probably all were the last one to be picked for sports because I was such a klutz and everybody knew it. I could barely throw a ball. Karma says, when my friend told my dad I was bleeding, he said, get a Band-Aid. No, Dad, it's a little bit more serious than a Band-Aid. It's not a scrape. We went full-fledged. You probably hit the pavement like I did, too. I was in the middle of our street, which was that gravelly with the rocks in it kind of stuff they used to use. They don't even make streets like that very much anymore, at least not that I've seen. But it's kind of like that gravelly where they have the big chunks in it. So it's not only like sandpaper, but it's a really gritty one. That's funny. Curved curb. Thankfully, I would have broke my nose. You know what I was just stupid. I decided I wanted to go to the right, so I just turned the handlebars like this one. Because I was going real slow. It was a week before kindergarten. Oh yeah. So then, you know, the bad thing is people were wondering if I was getting abused because I would always, or like I said, I was the original. My mom put these ace bandages, these thick ones, right around my head like this, and I'm not kidding you. They were like this thick on each side of my head, about probably 2.5 inches, because she used two really long ones, and I was the original helmet kid. Okay, I am the OG helmet kid from my mom in the 70s. They didn't even have bicycle helmets there, but damn it, I was the helmet kid. Because she was like, I can't let him walk. He hits his head. So yeah, I'm the OG camel kid. I wish I had a picture of that because it looks so silly. Your mom loved you and she did the best she could with you. That's very sweet. Oh, she did. But yeah, I was the OG helmet kid, just running around the thick old ace bandages. First day of school B. I bet you the first day of school they were looking at you like, oh, what the heck is going on here? Oh, geez. I'm going to have to make myself some more coffee here. Yes, the tism. It's the tism. Thank you for the hearts. So Ehlers-Danlos was named after the two founders, or the two people who discovered it, Mr. Dr. Ehlers and Dr. Danlos. And it's a rare disease. Autism is much more prolific than Ehlers-Danlos. I think Ehlers-Danlos is like 1 in 10,000 or some crap. I think it's much more prolific than what is reported, because I mean, and particularly with autism, if someone's autistic, the possibility of them having Ehlers-Danlos is so much higher. It's almost common. Harry, I was looking at my thing here. It looks like I really love myself on this live because here's two pictures of me because I was looking at it. I'll go back to my game. I was also diagnosed with mitral valve prolapse. Oh my goodness, at 12, and now linked to HEDS. Yes, and that's technically what I have, HEDS. Technically. But yeah, okay, yeah, and you I can't see your emoji. It's really small. Karma, you're female. With Ehlers-Danlos. Okay, since I had Ehlers-Danlos, I took my daughter to a geneticist when she got pregnant, and I flipped out when she got pregnant because she got pregnant at like 18, 19 or whatever, and I hadn't gotten her to a geneticist yet because I was flipping out when she told me she was pregnant because I didn't know what kind of Ehlers-Danlos she had, if she had it at all. Oh, I'm sorry to hear that. Karma says that she's miscarried twice. That is such a bummer. My wife had the same thing happen to her, and that's not cool at all. I'm really sorry to hear that. The problem with Ehlers-Danlos is there can be a type of Ehlers-Danlos that can be very, very dangerous for women having babies. Are you familiar with that? And so I took my daughter to a geneticist, and I asked her, and she actually was doing the test. She actually did a checked out the baby and everything else too. But the doctor's like, no, she doesn't have a heart issue, and because she doesn't have and doesn't display that, there's a very, very small chance that she will pass on Ehlers-Danlos. So that's really cool. The doctors didn't really care or think that that would affect the pregnancy. I almost bled out. Oh my goodness. Oh my goodness. I am so sorry to hear that. That's Yeah, I don't know how it affects pregnancy, to tell you the truth, except for the heart issue, and that can unlife mama, and of course the baby too. So yeah, that can be extremely important. But so here I am with this geneticist, and she's doing the ultrasound on my daughter. I don't know why she was doing an ultrasound, but she was doing an ultrasound on my daughter, checking out the baby and everything. And when she told me that my daughter didn't have Ehlers-Danlos, I was immediately in tears because, particularly when she said that there's very, very small chance of her passing it on to her kids. That basically, if they have Ehlers-Danlos, it would just be spontaneous anyway. Um, I was in tears, and it's so funny because the lady's like, "Well, that's the first time I've ever had tears." But I just didn't want my grandkids to have to go through the same crap I've gone through. My daughter is a little bit hypermobile, but I don't think she has Ehlers-Danlos by any means. She's definitely not like me and my son were. That was a year and a half ago. It is so sweet you went with her. Oh yeah, I was with her when she. I almost caught the kid too, because I was with her. Because I was a medic and so forth, and she felt comfortable with me. I was in the room with her and her mom when she had her first baby. Yes, everything went great with both of them, and her second son, I think, may be autistic. I don't know yet, but I haven't said anything to my daughter yet, but I'm kind of guessing that he's going to be a little bit delayed in certain things. Um, I'm just going to kind of like casually ask questions as things come up. Um, he may be autistic, he may not be. And if he is, we want to know. It's not a big deal. We don't care. Um, but if he is autistic, we want to know so that he can get the services and everything that he needs. Karma says, that's the best. She is very fortunate to have a knowledgeable and involved dad. I told my daughter she was autistic. And she's like, look, I don't care if I'm autistic or not. I want to know what's going on so I can do something about it. And that was her take on it. And my son said, it is what it is, when I told him he was autistic. So that's how traumatic it was for my family. I think after I got diagnosed autistic, it wasn't a big surprise when, my kids turned out to be autistic. And my daughter is 24. My son was 22 last year. Thank you. Yeah, he was 22. He also had a bone disease that, and this is not comorbid with autism at all. But he had a bone disease that's related to giantism and dwarfism, and his bones were very, very deformed in his legs to the point where he had to have two complete knee replacements by the time he was 17, which of course they cut off his growth plates because they had to. But he was about 5'6", I think, at the time. So, but he had a lot of things that happened to him all at once. He had alexithymia, which is an inability or difficulty regulating your emotions, which I have also. And he was not able to regulate his emotions, and there wasn't a damn thing I could do about it. I did everything I could for him. Um, and it wasn't my fault. It wasn't his fault. It was just um, shit happens sometimes, I guess. Isn't that also difficult identifying them? Now, with his bone disease, we didn't figure that out until he was about 6. Well, actually, he was in track. He was 15 in junior high, and he blew out his knee. And then we took him in, and they looked at the X-rays, and they're like, "Oh my goodness." Isn't it also difficult identifying alexithymia? Yes. We spent years and years and years trying to figure out what was wrong. He called it emotional numbness. And he complained that he either had no emotions or they were way too much. And that's exactly how I experienced it. And I didn't know what it was until after I got diagnosed with autism and started studying autism. We already identified it. We knew exactly what the hell was going on. But what ended up happening was once we figured out that we were autistic, then we found out about alexithymia and said, "Oh, that's it." You know. Yes, with alexithymia, identifying our emotions. Now, I have a video, and I have a video. It's something you might want to watch, but basically the way I see it is, imagine you have I made a graph, and imagine you have colors that are associated with each emotion, right? On a bar graph. And you could say, these are the good emotions and these are the bad emotions. And each one of those has a name. You know, I feel joy, I'm happy, I'm excited, whatever. And then you have the negative emotions. I'm sad, I'm down, whatever. With us, we experience all those emotions. However, it's all gray. And we have all those categories. It's either I'm bad or I'm good. Now, let's say my dog died, okay? I know that emotion is sad. That's the label that goes to my dog died. My grandson was born. Oh, I know I feel good, so therefore it must be joy. It must be happy. But it's either good or bad, if it's anything at all. Sometimes I don't have any, and sometimes I have too much. But I always thought when somebody said I'm happy that I didn't know that they were identifying a specific emotion. I thought they were saying good, and my grandson was born, therefore good is happy. That's the emotion that I feel. Instead of, I feel this specific emotion because I feel happy because this specific emotion, because my child was born or my grandson was born. I didn't understand that. Karma says, I've got an emotion wheel that helped me so much. I feel big emotions, sad, overwhelmed, happy. Okay, I never thought about that. An emotion wheel. So you look and you're like, I'm happy. And then you look at the situation, right? And you say, okay, this must be the emotion I'm feeling, overwhelmed, because there's a lot of work and I don't know if I can get it all done. Is that how it works for you? Because that's kind of how it works for me. But the thing is I may feel overwhelmed and not know that I feel overwhelmed. I have to stop and think, okay, what's going on here? And why do I feel this way? So Karma says, I've got an emotion wheel that helped me so much. I feel big emotions, sad, overwhelmed, happy, and those were it for the longest time. Lee says, I get you, I understand you, thank you for sharing your story. I don't know. I hope that makes sense as far as the emotions and so forth. I just think it's bizarre that's like I asked my wife one day. She's a mudblood. I call her a mudblood because she is only ADHD. See, if you are a true wizard, you are a pure blood if you are autistic and ADHD. But if you're just autistic, you're a mudblood. If you're just ADHD, definite mudblood. I am a pureblood wizard. Yes, I am autistic and ADHD. It starts with, Karma says, it starts with basic, happy, sad, then it branches out and lets you graduate from disappointment and so forth. That's kind of cool. If you can send that to me, Karma, I'm gonna friend you here after I get off of this live because it's gonna take me a minute to figure out how to do all that stuff. But if you could send me one of those charts or something like that on Discord, that would be really cool. I'm gonna try to look that up. I just don't know. Is it called an emotion wheel? Is that what I would need to look up?